Welcome to Medical Matters Weekly with Dr. Trey Dobson, presented by Southwestern Vermont Healthcare and Catamount Access Television.
Welcome, everyone. Today is May 11th, 2022, and I have to just start by saying it is a gorgeous day outside in southern Vermont, which I bring that up because I feel like it's just been raining for about 180 days straight. So I'm loving this weather. I know you are. I'm Trey Dobson, Chief Medical Officer at Southwestern Vermont Medical Center and an emergency medicine physician with Dartmouth Health. And this is Medical Matters Weekly, a show about the aspects of healthcare that matter to you most. I'm so pleased today to have a guest with me, a wellness coach and physiatrist, Dr. Beth Frates. And I mispronounced physiatrist, which I knew not to do. My apologies. Beth, welcome.
Thank you so much, Trey. It's a pleasure to be here today.
A little bit about Beth's background. She is an award-winning assistant clinical professor at Harvard Medical School. Where are you right now physically located? Are you in Boston?
This moment, I'm in Needham, Massachusetts.
Okay, yes, this moment. Okay. She's the director of lifestyle medicine and wellness for the Department of Surgery at Mass General Hospital. The bio goes on and on. I'm going to read a little bit more here. Worked as the director of the wellness program at the Stroke Institute for Research and Recovery at Spaulding Rehabilitation Hospital, which is a Harvard Medical School affiliate. And she's co-authored many books and courses. I'll just give you one so that you understand sort of the name and the ideas behind this. This is the Lifestyle Medicine Handbook, an introduction to the power of healthy habits, which is what we're going to be talking about today, not necessarily that book, but the overall concept. And she earned her medical degree at Stanford University School of Medicine and completed residency at the Harvard Department of Physical Medicine and Rehabilitation, which we call PMR among doctors and nurses. So thanks again, Beth. Tell us a little bit about, we talked about your more recent stuff. Tell us a little bit about where you're from and where you grew up.
Okay, terrific. I hesitate to say this right off the bat, but I'm a New Yorker.
No, that's great.
It's a little hard. I've been in Boston for almost 25 years, so I can say that. But a New Yorker, and I came to Boston for college, loved Boston. In fact, it was my grandparents who immigrated from Vassara, Greece, who first came to Boston. That's where my mom grew up in East Boston. And then my dad and mom met in Morocco, where dad was an Air Force pilot and mom was teaching English on the base. And they raised my brother and me in New York. Got to Boston, loved it. Then went to Stanford for medical school, really enjoyed that, loved it, because you just talked about the beautiful weather here. If you've been to Palo Alto, you know many, many days are sunny and beautiful like this. And then I came back, though, to Boston and have been here at the Department of Physical Medicine and Rehab and at Harvard Medical School since 1996.
So what got you and what attracted you to medicine in the first place?
I love these stories. I actually would love to hear your story, and perhaps I'll find it on one of your previous podcasts. But for the moment, I'll share mine, which has to do with a particular patient. If I may share that patient, I think it will make things come to life for you and your listeners. The patient has given me full rights to share everything about the story. So if that's all right, that's how I'll let you know.
Absolutely, would love to hear it.
Okay, so I'm going to tell you about a gentleman. When he was 52 years old, he was overweight, overworked New York City businessman who dined almost exclusively on fast foods. He was a New Yorker, so he walked fast, talked fast, ate fast, and sometimes all three at the same time. He unfortunately did not sleep much because he worked all the time. He was very stressed. He was running his father's business, and everything was about getting the clients their outcomes they needed. And he did have family. He had kids, but he was not really present when he was with them. He was always at work. Even if his body was at home, his mind was at work. Very stressed. You may know someone like this. Really overworked. And even though he was an outstanding athlete as a high schooler and college age person. He at this time was doing no activity at all, no movement, just sedentary. That's not entirely true. He did one thing and it was sporadic, and you never knew which day he would do it, but you knew the exact time at which he would do this exercise. He would always do it at 11:07 p.m. This exercise. This exercise is a mad dash, an actual sprint, as fast as he could go. And that's because he worked at Park Avenue, 101 Park Avenue, and to get to Grand Central Station, it took just a specific number of minutes for him to sprint to catch the last train home. And that was his life. And on one of these mad dashes, these sprints, he had a little pressure, a little pain in his left chest. No pain, no gain. Forge forward, made the train. I'm sure we have many people who are healthcare professionals or not even healthcare professionals who are hearing this story right now and predicting the outcome of the story. And it is what you're going to predict: numbness and tingling down the left arm into the hands, diaphoretic, sweaty, short of breath, pale. And his wife, who was a teacher at the time, picked him up at the station and took one look at him and took him right to the local emergency room, where he completed his massive myocardial infarction and his right middle cerebral artery infarct, leaving him paralyzed on the left side at the age of 52. So how did I get interested in medicine? Because of this particular patient. Because that happened when he was 52 and I was 18. And that's my dad's story. That's my dad's life. And I'm really happy to say he made a full recovery, except for fine motor movement of the left hand. And if you're in stroke, or you know physiatry, or you've worked with stroke, I know you're in the ER, so you've likely seen multiple stories like I just shared. He did work with physical medicine rehab, PTOT, and recover everything except for manipulating coins, really fine objects, small objects in his left hand. He went to Pritikin and Whitaker. These were lifestyle medicine programs that were intensive, where he and my mom went to California for 12 weeks, learned how to cook healthy foods, learned how to exercise, did cardiac rehab, and learned about stress reduction and deep breathing. And he did change his entire life, and he lived his happiest, healthiest years, 27 years after that stroke. And that's why I do what I do. That's what got me into medicine. I'm fascinated by the human body, the brain, the heart. I'm fascinated even to this day, after being in medicine for so many years. It still fascinates me. And as you know, we're learning more and more every day. When I was in medical school, we didn't know there was neurogenesis. We didn't know that you could actually increase the number of neurons in your brain, let alone did we know that if you exercised, you could increase BDNF, right? Brain-derived neurotrophic factor, which is that factor that helps us increase neurogenesis. So it's fascinating to me. But also the root of this is I saw the suffering myself. I saw this with my own two eyes, and I lived it as the daughter and part caregiver for my dad. And I really wanted to figure out how we could prevent this from happening to others. It seemed unnecessary. And I have gone into the branch of medicine called lifestyle medicine. I'm not sure, are you familiar with it, Trey?
Well, I'm into wellness myself. I have not actually pursued a course that is specific to lifestyle medicine, but certainly the concepts. Why don't you talk about, actually, first off, I just have to tell you that story is inspirational, it's motivational. You told it in such detail because you experienced it in such detail that I think that I can see the movie right now, and I can see your dad, running down the street with his probable LAD occlusion, holding on to his chest there. So thank you for sharing that with all of us, and it's a powerful way to start this conversation off. Let's talk a little bit about those concepts of lifestyle medicine and what they mean, not only what you've learned, but what they might mean for you in particular.
Right. So interestingly, in medicine, when I was at Stanford, I graduated in 1996, and there was no such thing as lifestyle medicine. It was really preventive medicine, which at that time was a lot of epidemiology. It wasn't about counseling patients on how to lead a healthy life. So I chose the specialty and the residency of physical medicine rehab to work with stroke survivors and help them prevent a second stroke. And I'm not sure, it's hard to tell how old people are. I don't know when you graduated, but in my era, we didn't have lectures on exercise, nutrition, stress resiliency. These weren't part of medical school for me. And so when I wrote a book in 2006 about preventing a second stroke, I dove deeply into these subjects: exercise, stress resiliency. I had done my thesis at Harvard because Dad had that heart attack and stroke when I was a Harvard freshman. I changed my major from economics to pre-med and biology and psychology. And I pursued a thesis on mental stress and the heart, looking at when people experience mental stress, such as we used in the experiment: subtract 7 from 100, subtract 7 again, subtract 7 again, serial sevens. We saw EKG changes similar to when the patients were on the bicycle for their stress test. These were the subjects. So back at 18, I knew, no matter what anyone was saying, this was in 86, I knew that there was a connection between our brains and what's happening in our heart. So when I went to write this book about preventing a stroke, of course, I talked about high blood pressure and diabetes and all those things I learned at Stanford Medical School, but I wanted to go deeper. I wanted to really understand the behaviors that were behind those diseases. And that's why I dove into exercise, nutrition, specifically stress reduction. These are 3 of the pillars of lifestyle medicine. It was after writing that book that colleagues said to me, "Hey, you're doing lifestyle medicine." The American College of Lifestyle Medicine was born in 2004. I didn't know. And I explored this lifestyle medicine and in fact partnered with a colleague here, and we started the Institute of Lifestyle Medicine and started doing CMEs here at Harvard about exercise prescription, nutrition prescription, and stress resiliency prescription. Those blossomed into 3 more. We have 6 pillars of lifestyle medicine: exercise, nutrition, stress resiliency. Here are the 3 new pillars: sleep, getting sound sleep, 7 to 9 hours. And then what else? Social connection. I used to have to work really hard, Trey, to get people, physicians and patients to understand the power of social connection. And I'd get into oxytocin. I would get into we are born to bond and we want to bond. Maslow's hierarchy of needs. We have food, shelter, and then love and belonging. But guess what? I don't need to convince anyone that social connection is important for our health anymore after COVID. Everybody's right on board. And then that last pillar is avoidance of risky substances. So smoking, excessive alcohol, opiates. We know about what we're experiencing here in New England with the opioid epidemic. So these 6 pillars are what we practice, and they're the foundations of lifestyle medicine. Most people who practice lifestyle medicine also have an MD degree, so they will likely be prescribing medications as well. However, you can be certified in lifestyle medicine as a nurse, as a health coach, as an exercise physiologist, as a nutrition specialist. So we're a team. It's a little like physiatry, where you have the physical therapist, occupational therapist, social worker, psychologist, physiatrist, nurse, health coach. We have in lifestyle medicine, the lifestyle medicine practitioner, the health coach, the nurse, the exercise specialist, nutrition specialist, and it's really a team approach. And it's not just telling people what to do, Trey, because you know this. Well, you're in the ER, so a lot of times you have to tell people what to do and what their next course of action is because they're in an emergency situation. We're talking about chronic diseases in lifestyle medicine, right? We're talking about cardiovascular disease, obesity, diabetes. These are chronic conditions. And just wagging your finger and telling someone to exercise more, eat more greens, this approach is not effective long term. So we do a lot of work around behavior change. And that's why you mentioned I was a health and wellness coach, and I was one of the first physicians to take this seriously, become certified in health and wellness coaching, because I wanted to, my whole job, I feel, is to empower people to make lifestyle changes so they can live their best life without suffering that heart attack and stroke that so many people like my dad suffer before they get that realization.
And this is a great time for the audience to know that Dr. Frades is giving complimentary with the Introduction to Lifestyle Medicine course for those in the audience, particularly those in healthcare or perhaps into wellness themselves, who want to learn more about how the actual, not only the program works, but how they could be involved in that and part of their life as far as the coaching itself goes. If you're a physician and you're interested, this is there's CME credit. There's probably CE credit, although we've not verified that yet for nursing. But certainly it's the experience that will be so meaningful. And whether you just take from that one particular course, or you decide to continue your education, professional and personal education. Beth, you brought up something with these pillars that you did a really good job of outlining those pillars, and really, to me, you articulated them so well that I was trying to think of what ties them together, and how you motivate not only patients, but sometimes it's family and it's friends, it's even colleagues that may start coming to you, recognizing your interest and your skill set. And one thing that I see that sort of ties them together is really finding joy, which is something that's important in my life. And I personally know that finding joy is hard to do without really following almost all 6 of those pillars: exercise, mental health, social interaction, avoidance of excessive amounts of certain substances, because physical health and mental health are so closely related. And it's important to find that joy, or else there's no hope, there's no motivation. What do you do to help motivate patients? You said you can't shake your finger at them. We know that. What techniques do you find that tend to work?
So wonderful, Trey. We just met, but I feel like we have a lot in common, and tapping into joy. That would be my answer. So with each patient, it's different. I've been doing this for a while now, really practicing and coaching patients, and, by the way, providers as well as patients, since 2008. And I will tell you this, there's no one size fits all. You have to get to know the person that's in front of you, the whole person that's in front of you. So the first thing when we're going to counsel on behavior change, I have a 5-step cycle I'd like to just take you through that I developed after 2 or 3 coaching trainings. And I wanted to share this with colleagues in a way that they could take home. So maybe your listeners can use this if they're providers or patients, and they could use it on themselves, or maybe even family members. The first thing you do is you sit with the person and you listen. You want to fully understand who's in front of you. What's going on with you right now? Are you feeling you want to change? Do you want to start exercising? What are you feeling you want to take on with these 6 different pillars? Which one interests you? What have you tried in the past? When have you been successful? So just listening to their story and really expressing empathy. So this is putting the phone away, putting your to-do list away, being fully mindful in this moment, as you and I are right here, right now in this podcast. And your whole attention is on the other person. And by the way, that's a huge gift to give someone, your undivided, full presence. So you start there, and then you must tap into motivators. What's really important to you in this world right now? My kids, usually people say, my grandkids, maybe my job, maybe my dog. There's a lot of answers I've heard. My promotion, I've heard a number of things. Then you see how the behavior may have an impact on that. either relationship, project, profession, and connect the motivation to do well or to succeed in that area with a healthy lifestyle. So you connect their internal motivator. Now, sometimes I get motivators like this, Trey. I'm here to see you because I saw you worked with Jody and she lost 30 pounds and I want to get into a bathing suit in 2 weeks. So I'm here for you to help me lose 30 pounds in 2 weeks. So I will get a bit of that. And that is what I call an external motivator, something else. I want to do this either for money or to fit into clothes, or what I'm looking for is this internal motivator, meaning when I exercise, I feel good. I feel creative. I feel energized. I feel calmer for the rest of the day. So I'm looking for things internally. If it's for food, I feel like when I eat a whole food, plant-based diet meal for a week, my energy seems to be stabilized throughout the day. My skin seems to glow. It's interesting. And I have this internal reason why I want to eat healthy. So we tap into the motivator. That's the second step. And then we want to help people feel strong, feel an increase in this belief that they can make the change. So we'll look at strengths. It's a strengths-based approach. I will ask, what are your strengths? And a lot of people, that's a tough question because they don't like to talk about their strengths or they never ever thought about them. But it's an important question. So we get to, what are your strengths? If they can't tell me, I say, well, tell me about a time you succeeded at a goal. And they'll tell me about a goal. And then I'll say, what strengths did you use? And they'll identify, and then we'll solidify some strengths. And then we talk about how we can use these strengths to change behavior. Then we're ready to set a goal. Not this goal. Look, this may be someone's goal on the line. I don't know, but no, I'm not looking for this goal. This is called a big, broad goal. I want to lose 30 pounds. I'm looking for a SMART goal, a specific, measurable, action-oriented, realistic, and time-sensitive goal. So you have to really sit with the patient a while to craft that and work on it. And then there has to be accountability, Trey. So you set the goal. You can't just set it, bye-bye. Okay, good luck with that. We have to have some follow-up, either with you or with a buddy, a family member, right? So I was working with my dad on his hand and the ball that he had to work on to get his strength back in his hand. So having some accountability to someone, with someone, and sometimes it's in social media in a forum of some kind where you post your goals. It can be any way that resonates with the patient to reach the goal. And then you see them again, hopefully, right? I know in the ER, you don't always see people again. Hopefully you don't actually.
Hopefully I don't, that's right.
Right, you send them to.
But I do see them in the community, and that's important.
Okay, so that's nice. And then they can report back to you. So for me, I'll have a set time where I'm going to see them again. And then I start at empathy. It's a cycle. I start at empathy again. I check in on the motivation. I talk about strengths, affirm what went well, brainstorm around obstacles. And then we will go ahead and set a new goal, set accountability, and we'll go through this 5-step collaboration cycle again, all based on the patient and what they give me, not on my plan for them. What are they capable of? What are they interested in? What brings them joy? Absolutely. Love leads.
You know, you provided me, to the audience, for their knowledge, can't see this, but you provided me with one of your workbooks. It's called Paving the Path to Wellness Workbook. And I haven't gone through it all yet. I will, I promise, but I have flipped through it and I see a lot of graphics. You know, it's not just fine print. It's really attractive in that way. In itself, motivating to want to complete and participate. I see graphics, patient stories, some recipes. Tell me a little bit about I'm just pulling something out here, the sugar cycle.
Oh, yes. The practitioners and patients alike enjoy this. So I don't know about you, Trey, but I'll be honest and say that during my internship at Mass General in 1996, I had to stay up all night, several nights. We were Q2 for a couple months during our internship days. That's before the rules and regulations changed, and I would be really tired. And one of the things I would do in the middle of the night, I will admit this out loud to, I don't know how many people are listening, but I would go to the vending machine on the first floor at Mass General, and I would pop in that whatever 75 cents, click on the button for Starbursts, and I would let them drop down. And it was almost like just the act of the dropping, I would start to salivate and I would pull out that whole package, not just one. I didn't have one little square. No, the idea was I would get that Starburst pack, and I literally would sit and do some notes and eat the entire package. That was the plan. I wasn't just getting it to have one. I was getting it to have the entire, that was the serving to me, the entire, I would eat that, and then I would be motivated, energized, run around. And the problem is with the sugar cycle, I get the high glucose, and the body isn't built for this. So the pancreas releases the insulin, going to bring that sugar back into the cells out of the bloodstream. And that's the job. So we can stay and have some kind of homeostasis and steady state. But what happens to most people is then you get a drop in your blood sugar. And guess what? You're hungry again. That's not satiating. That 12 Starburst pack, it's not satiating. I'm hungry again. And I reach for something that's going to give me that reward. It's going to hit the nucleus accumbens. It's going to hit my brain and provide me a dopamine rush, and I can rely on it. And for me, it was that sugar. It was that Starburst. So I would go back later in the evening and have another round of Starburst. So I'm just sharing my personal story, but it happens with anyone that's consuming sugar. You get the sugar high, pancreas releases insulin. We know that insulin is a great fat storage hormone too. So anyway, then you get the higher insulin, and then the sugar goes down, and we go through this cycle. And it makes you look at Starburst anyway, a whole different way, in a whole different light. And interestingly, just saying, a lot of people that I coach, because we try to move away from the sugar and we try to go to whole foods. And they'll say, oh, you know what? I just had my dentist appointment. For the first time, I don't have any cavities. So this will not only help your arteries and help you reduce inflammation throughout your system, it also ends up happening all over your body, and including your oral hygiene, which we know is so important. And I will tell you, the first time I ever got a cavity, I didn't have any. I haven't had any since, and I didn't have any until internship. I left internship, went to my dentist, and literally he said, "What happened to you?" That is what he said. What happened to you? And I said, well, what do you mean? Nothing. I was just an intern. Okay. Because apparently, by the way, I had 2 cavities, which I never had before, and I was grinding my teeth.
Oh, sure. And the example you gave is great, because I think many people can relate to a similar habit they have with sugar, and they do know, and they identify the physical drop, but it sometimes takes them realizing the mental drop, which parallels it, and in order for them to stop that cycle, it's not just the physical aspect that motivates them. It's recognizing, oh wait, I feel not only sluggish, I feel down. And is that maybe, am I feeling depressed with this? And when they stop that sugar cycle, they see that not only is their physical prowess more level, their mental is as well. And of course, I say that from my own experience too. I fortunately don't have a sweet tooth. I have a lot of other things and habits that I want to change at times, but that one I don't have. But I do know if I eat several Starbursts on occasion, I just start feeling depressed, because it drops my mental energies as well. What do you see as we finish up here? And we're going to have you back on the show, Dr. Freitas. This is just great. Tell us what you see the challenges are with many of your patients. I know they each have their own individual challenge, but in general, what do you come across most often?
Well, since the pandemic, I have noted that there's been an increase in consumption of food, alcohol, increased stress, and reduction in sleep. All really related. And this is the thing about these 6 pillars, they're interrelated. So I will say that trying to help patients with their stress and stress reduction is one of the best things that we can do, because once we know how to manage our stress. So for example, it goes back to the Starburst story in a way. I mean, I was super stressed and I needed some relief. And for me, I was going to the sweets for that. But I learned mindfulness-based stress reduction on this journey in lifestyle medicine, John Kabat-Zinn's work from UMass. I took a CME where I learned how to really relax and focus in on my breath, and learning how to use your breath to recenter yourself and help turn on that parasympathetic rest and digest calm versus the sympathetic fight and flight has really been powerful. And when patients can take that step back and learn what they can do for stress reduction, it really helps the other pillars. And you can see how that may be. Now, I'll say sometimes people really need a good sleep. And when they take that sleep, that time for solid sleep, a lot clears and there's more energy, they're more likely to exercise. And then once people are exercising, right, they get more energy, they get more mitochondria in your cells. And these mitochondria are the powerhouses, the energy powerhouses. And by exercising, you increase the number of mitochondria. So that in itself is healthy. Now, when you're talking about somebody's trying to lose weight, you may want to start with looking at what the diet is and just taking a glance and just getting a log of a day and just non-judgmentally. Of course, this is a place of no shame, blame, guilt. This is a place of lifestyle medicine. This is a place of learn, explore, grow, investigate. And so for them, it may be, wow, I didn't even realize I was consuming that quantity of food, or that I wasn't consuming any vegetables. So it does depend on the person, but I would just, if I had to say, it's been increase in stress, and I've been working far more with my mindfulness-based stress reduction skills that I learned most recently in my career in medicine. I learned those back in 2012, but I'd say they're coming in handy, very handy right now to help others rest, relax, restore.
It's great. And you are right. We need this more than ever now. Thank you so much for joining us on the show, Beth. It's been wonderful. And like I said, we're going to have you back maybe in several months, and we can go into phase 2 of our discussions.
Great. Thank you so much. I do want to make sure that everyone gets the code for the free American College of Lifestyle Medicine course. So if you go to the website for American College of Lifestyle Medicine, the code to get the free course is Intro to LMMW 22.
Great. And we will put that in the show notes. I also typically send out information to our own medical staff and nursing staff, so I'll include it there if that's okay. And again, Beth Frates, medical doctor and a physiatrist, and also practices lifestyle medicine. You can listen to this show again on your own. You can send it out and listen to it on podcasts and Spotify and other sources. I'd also like to thank Mike Cutler from Cat TV, which is yet another source that you can see the show. And of course, Cat TV is sponsors this show. Ray Smith from Southwestern Vermont Healthcare, Ashley Jowett from Southwestern Vermont Healthcare. I'm Trey Dobson. Go out and find joy in everything you do, even in the face of adversity. And we will see you next week.